Hey guys, it's been a while since I've sent out videos, and I'm going to start this up again with installments on what I call health risk management, which are actions we can take to reduce the chances of bad health outcomes. So in this first episode, I'm going to go over the single most important thing we must manage in order to dramatically reduce the chances of contracting the many diseases that afflict the American population today. And that is, we must be as insulin sensitive as possible. Let's take a look at a table from a study that looked at people in various disease states and whether or not these folks had high insulin levels or not. And high insulin levels refers to hyperinsulinemia. The authors conducted a systematic review to determine whether hyperinsulinemia was present in disorders associated with the metabolic syndrome. The researchers reviewed 423 publications. 58 were selected because of appropriate documentation of insulin measurements. Comparisons were based on whether the studies reported patients as having increased versus normal insulin levels for each metabolic disorder. The presence or absence of hyperinsulinemia was documented in these articles as follows. Now, the first number I read is going to be yes, there was hyperinsulinemia, and the second number, there was not. Central obesity, 4 versus 0. Diabetes, 5 versus 0. Hypertension, 9 versus 1. Dyslipidemia, 2 versus 0. Renal failure, 4 versus 0. Non-alcoholic fatty liver disease, 5 versus 0. Polycystic ovary syndrome, 7 versus 1. Sleep apnea, 7 versus 0. Certain cancers, 4 versus 1. Atherosclerosis, 4 versus 0. And cardiovascular disease, 8 versus 0. There were 4 articles that were examined with insulin levels in the metabolic syndrome as a whole, and this was 4 versus 0. As you can see, it is uncommon to find people with these diseases who are insulin sensitive. All right, very informative. Let's look at another chart. This is known as Krafts Area under the curve. This is very important. Joseph Kraft was a pathologist and author of Diabetes, Epidemic in You. He discovered that there are 5 typical patterns of insulin response to the glucose tolerance test, which describe the feature of the diseased state. According to Professor Grant Schofield, these are really what we should be considering in early identification of metabolic problems. Unfortunately, the glucose tolerance test is rarely run long enough, nor is insulin, which is key to this, measured concurrently. What Kraft found was, even though fasting blood sugars are normal, the insulin response was not. As you can see from the chart, there are 5 patterns identified. Patterns 3 and 4 are a state of hyperinsulinemia with normal fasting blood sugar. What we take away from this is, although you may have normal blood sugar readings, you may be in a state of chronic high insulin levels. In fact, it may take up to 10 years before you become diagnosed with diabetes. Okay, we have one more item to review. Now, this is an excerpt from a study, a recent study, that looked at diet and athletic performance. Now, we're not going to go over the particulars of this study. However, there was a finding that I want us to all take a look at. Here you go. This study used middle-aged competitive distance runners. The aim of the study was to challenge the long-held belief that short, high-intensity and long, lower-intensity athletic performance is best with a high-carb, low-fat diet. The study is in the links if you would like to look through it. 30% of the athletes went on the high-carb, low-fat diet had a 31-day mean, median, and fasting glucose level greater than 100 milligrams per deciliter. The range was 111.68 to 115.19. which put them in the pre-diabetic range. The takeaway is, just because we train hard doesn't give us a free pass on our nutrition. Said another way, we cannot outrun, train, or exercise poor dietary choices. Although this is anecdotal, one of the lead authors of the study is Professor Timothy Noakes, a professor of exercise science at Cape Town University, South Africa. He is well known in endurance racing. He ran 70 marathons and ultra-endurance events and became diabetic from excessive carbohydrate loading. He is now a low-carb advocate for both sports performance and everyday life. All right, so hopefully everybody is up to date on the role high insulin levels play in the majority of the diseases that affect us. On the next episode, I'll go over things that we can do to maintain or improve our insulin sensitivity. See you next time.